Welcome back to Language Access Academy. This is it, the final stretch of our journey through the American Medical Association's Glossary of Medical Terms. In this concluding episode, we are going to cover the rest of the alphabet, from U all the way to Z. Let's finish strong. Starting with the letter U, an ulcer is an open sore that occurs on the skin or on a mucous membrane because of the destruction of surface tissue. Ulcerative colitis is a chronic condition in which ulcers occur on the mucous membrane lining of the colon and the rectum. Ultrasound scanning, sometimes called sonography, is an imaging procedure used to examine internal organs in which high-frequency sound waves are passed into the body, reflected back, and used to build an image. Ultraviolet light is a form of invisible light in sunlight that is responsible for the tanning and burning of skin, and it can cause cataracts and skin cancer. During pregnancy, the umbilical cord is the tubal structure consisting of two arteries and one vein that connects the fetus to the placenta, supplying oxygen and nutrients and removing waste. An umbilical hernia is a condition present at birth in which a part of the baby's intestines bulge through a weak area of the abdominal wall, creating a swelling around the navel. Unconsciousness is a temporary or prolonged loss of awareness of self and of surroundings. An undescended testicle is a testicle that has not moved down from the abdomen, where it develops into the scrotum. Unsaturated fat is a fat or oil found mainly in vegetables. It is thought to reduce the risk of coronary heart disease. Urea is a waste product of the metabolism of proteins that is formed by the liver and secreted by the kidneys. Uremia refers to abnormally high levels of waste products, such as urea in the blood. Now let's look at the urinary tract. The ureters are two tubes that carry urine from the kidneys to the bladder. The urethra is the single tube by which urine is released from the bladder. Urethritis is the inflammation of the urethra. A urethrosal is a bulging of the urethra into the vagina, and erythrocystitis is the inflammation of both the urethra and the bladder. A urinalysis is a group of physical and chemical tests done on a sample of urine to check for various disorders. A urinary diversion is an operation to allow urine passage when the bladder or urethra has become blocked or been removed. Urinary incontinence is the involuntary release of urine because of the inability to control bladder muscles. The urinary tract comprises all structures responsible for the production and release of urine, including the kidneys, ureters, bladder, and urethra. Urticaria is an allergic reaction in which itchy white lumps surrounded by areas of inflammation appear on the skin. It is commonly called hives. Uterine prolapse is a condition in which the uterus moves downward into the vagina due to a weakness of the ligaments and muscles that hold it in place. The uterus is the hollow female reproductive organ in which a fertilized egg is implanted and a fetus develops. The uvea is a structure consisting of the colored area of the eye and the middle layer of the eye that contains blood vessels. Uveitis is the inflammation of the uvea. Moving right along to the letter V. A vaccination is a form of immunization in which killed or weakened microorganisms are placed into the body, where antibodies against them are developed. The vaccine itself is that preparation of weakened microorganisms given to create resistance to a certain disease. Vacuum aspiration is the removal of the contents of the uterus using a suction device. Vacuum extraction is a technique used to facilitate childbirth using a suction device to help move the baby through the birth canal. The vagina is the muscular passage connecting the uterus with the outside genitals. Vaginismus is an involuntary muscle spasm at the opening of the vagina when sexual intercourse is attempted. Vaginitis is the inflammation of the vagina, which can result from infection, aging, hormone deficiency, or a foreign object. A valve is a structure that allows fluid to flow in only one direction. A valvotomy is the surgical correction of a narrowed heart valve. Valvular heart disease refers to a heart valve defect, and a valvuloplasty is the reconstruction or repair of a narrowed heart valve. Varicella is the medical term for chickenpox. Varices are enlarged or twisted blood or lymph vessels. A varicocele is the appearance of varicose veins around the testicles. It is harmless but may cause discomfort. Varicose veins are enlarged, twisted veins just below the surface of the skin, caused by defective valves in the veins. Variola is another term for smallpox. Vascular means pertaining to blood vessels, and vasculitis is the inflammation of blood vessels. The vas deferens is a thin tube that stores and transports sperm. A vasectomy is a usually permanent method of sterilization in which the vas deferens are cut and tied off so the semen will no longer contain sperm. Vasoconstriction is the narrowing of blood vessels, while vasodilation is the widening of blood vessels. A vasovagal attack is a sudden slowing of the heart causing fainting. You might see the abbreviation VID, which stands for venereal disease, coming up in a moment. A vein is a blood vessel that carries blood toward the heart. A venereal disease is any disease that is usually spread through sexual intercourse or genital contact. Venipuncture is the piercing of a vein with a hollow needle to inject fluid or withdraw blood. Venography is an X-ray procedure for viewing veins. Venom is a poisonous substance produced by certain animals. Ventilation is the process through which oxygen and carbon dioxide are exchanged between the lungs and the air. It also refers to the use of a machine to carry out this process. That machine is called a ventilator. A ventricle is a small cavity or chamber. There are 4 ventricles in the brain that circulate cerebrospinal fluid and 2 in the heart that pump blood throughout the body. Ventricular fibrillation involves rapid, irregular contractions of the heart. A ventricular septal defect is a hole in the wall that separates the 2 lower chambers of the heart. Vernix is the thick, greasy substance that covers the skin of a newborn baby. Aversion is a shift in the position of the fetus inside of the uterus, either occurring naturally or performed by a doctor to facilitate delivery. A vertebra is any one of the 33 bones that make up the spine. The vertebral arteries are a pair of arteries running up the neck to supply the brain with blood. Vertebrobasilar insufficiency involves episodes of dizziness and weakness caused by insufficient blood flow to the brain. A vertex presentation is the usual head-first presentation of the fetus during delivery. Vertigo is the feeling that one or one's surroundings are spinning. Very low-density lipoprotein, or VLDL, is a class of blood proteins, a high level of which is associated with coronary heart disease. A vesicle is a small skin blister, or any sac in the body that contains fluid. The vestibular glands are 2 small glands located at the opening of the vagina that secrete a lubricating fluid during sexual stimulation. Villi are the millions of finger-like projections on the lining of the small intestine that aid in the absorption of food. The term viral describes something related to or caused by a virus. Viremia is the presence of viruses in the blood. Virilization is the process by which a woman develops male characteristics due to an overproduction of male sex hormones. Virulence is the relative ability of an organism to cause disease. A virus is the smallest known disease-causing microorganism. They are very simple in structure and can only multiply when they are inside the cell of another organism. Visual acuity is a measure of the sharpness of a person's vision. The visual field is the area on both sides that can be seen while looking straight ahead. A vital sign is any sign, such as a pulse, that indicates a person is alive. Let's do a quick rundown of some essential vitamins. Vitamin A is essential for normal growth, protection of mucous membranes, normal vision, and healthy skin and hair. The vitamin B complex is a group of vitamins including thiamine, niacin, riboflavin, and folic acid. It plays roles in hormone production, metabolism, and the nervous system. Vitamin B6 plays an important role in the breakdown of energy sources and the production of red blood cells. Vitamin B12 is essential to the production of DNA and red blood cells. Vitamin C maintains healthy bones, teeth, gums, and blood vessels and helps the immune system. Vitamin D plays a role in the absorption of calcium by the intestines. Vitamin E protects tissues from damage by oxygen-free radicals. And vitamin K is essential for normal blood clotting. As a group, vitamins are complex substances necessary in small amounts to maintain health and ensure proper body functioning. Vitiligo is a condition in which patches of skin on the body lose their color, thought to be caused by the immune system attacking the skin tissues. The vitreous humor is the clear, watery fluid that fills the cavity of the eye behind the lens. We mentioned VLDL earlier, which stands for very low-density lipoprotein. The vocal cords are 2 strips of tissue in the voice box that have the ability to produce sound when air passing through them vibrates. A volvulus is the twisting and obstruction of an area of intestine. Von Willebrand's disease is a genetic disorder characterized by excessive bleeding. VQ lung scans are images produced by radionuclide scanning of the lungs to help diagnose a pulmonary embolism. The vulva is the outer visible portion of the female genitals. Vulvitis is the inflammation of the vulva, and vulvovaginitis is the inflammation of both the vulva and the vagina. Now into the letter W. Walleye is a condition in which one eye turns outward. A wart is a contagious harmless growth caused by a virus that occurs on the skin or a mucous membrane. Weber's test is a test in which a vibrating tuning fork is held against the forehead to help determine the cause of hearing loss. Wegener's granulomatosis is a disorder in which nodules associated with inflammation of blood vessels develop in the lungs, kidneys, and nasal passageways. Weight-bearing exercise is exercise that puts stress on bones, such as walking, which helps build up bone density and prevent the bones from becoming brittle. Wernicke's encephalopathy is a brain disorder characterized by abnormal eye movements, difficulties with muscle coordination, and confusion. It is usually the result of chronic alcoholism. A wheeze is a high-pitched sound produced during breathing because of the narrowing of the airways. It is a common sign of asthma. A whiplash injury is an injury to the ligaments, joints, and soft tissues of the neck region of the spine because of a sudden, violent jerking motion of the head. Whipple's disease is a rare disorder that has widespread effects on the body, including impaired absorption of nutrients, weight loss, joint pain, and anemia. A whipworm is a small, parasitic worm that can live in the intestines of a human and may cause diarrhea, abdominal pain, and anemia. A white blood cell is a group of colorless blood cells that are part of the immune system, helping to prevent and fight infection. The white blood cell count is the number of these cells present in a blood sample, useful in diagnosing various infections. A whitehead is a painless, small white bump. It usually occurs in groups on the nose, cheeks, or around the eyes. A whitlow is an abscess on the end of a finger or a toe caused by the herpes simplex virus or a bacterial infection. Whooping cough is the common name for pertussis. Wilms tumor is a type of kidney cancer that usually affects children under the age of 5. Wilson's disease is a rare genetic disorder in which copper builds up in the liver and is released into other parts of the body, eventually causing damage to the liver and brain. Withdrawal bleeding is bleeding from the vagina that occurs when hormone levels drop, such as menstruation or the bleeding that occurs at the end of each cycle of the combined oral contraceptive pill. We are almost at the finish line. Let's cover the letters X, Y, and Z. Xanthelasma refers to fatty deposits around the eyes that are common in elderly people and associated with high levels of cholesterol. Xanthine is a bronchodilator drug used to treat asthma. Xanthomatosis is a condition in which fatty deposits occur in various parts of the body, possibly leading to atherosclerosis. The X chromosome is one of the two sex chromosomes. It determines female sex characteristics. Xeroderma pigmentosum is a genetic disorder in which the skin is extremely sensitive to sunlight, causing it to age prematurely and leaving the individual particularly susceptible to skin cancer. Xerophthalmia is the excessive dryness of the cornea and conjunctiva due to a lack of vitamin A. An X-linked disorder is a genetic disorder in which the abnormal gene is located on the X chromosome. Those affected are almost always men. An X-ray is a common term for radiography. XYY syndrome is a disorder in which a man has an extra Y chromosome, causing him to be unusually tall and to have behavioral disorders. Moving to Y, the Y chromosome is the sex chromosome that determines male sex characteristics. A yeast infection is a term usually referring to a candidiasis infection. Yellow fever is a life-threatening viral infection transmitted by mosquitoes that causes jaundice, fever, headache, and vomiting. And finally, the letter Z. You might see the abbreviation ZIFT, which we will define fully under zygote intrafallopian transfer. Zinc chloride is a white powder used as an antiseptic and antiperspirant. Zollinger-Ellison syndrome is a rare disorder in which tumors form in the pancreas and secrete the hormone gastrin, which causes an increased production of gastric acid and recurrent peptic ulcers. A zoonosis is a parasite-caused or infectious disease in animals that can be transferred to humans. A zygote is the cell that results when an egg is fertilized by a sperm. And our very last term, zygote intrafallopian transfer, or ZIFT, is a method used to treat infertility in which an egg fertilized outside the body is placed into a woman's fallopian tube. Congratulations, you have made it through every single medical term in this audiobook. We have covered the entire alphabet, and you should be incredibly proud of your dedication to learning. Remember, repetition makes perfect. Come back whenever you can and listen again to reinforce what you have learned. Please stay tuned and subscribe for more great learning materials right here at Language Access Academy. Great job, and we will see you next time.